Right, thank you very much for joining us here at Rockingham today for this press conference on Australia Day. Can I just begin by acknowledging and congratulating all of the new citizens of Australia, and in particular those in Western Australia who took their oath of citizenship or their affirmation of citizenship today. So congratulations to each and every one of them. I know it was a very big decision and the culmination, no doubt, of many years of effort, and terrific to see the excited families here today. Can I also congratulate all the recipients of awards across Australia, the Australia Day Awards, very worthy people, and it was great to see some very good acknowledgement of some West Australians who received those awards today as well. So can I congratulate each and every one of them. To COVID, just the latest information. Overnight, there has been 24 new cases across Western Australia. Of those, 9 were from Bunbury, and that takes the total in the Bunbury cluster or the Greater Bunbury cluster to 16 cases overall over this outbreak. And so that's 16 at this point in time, but 9 overnight in Bunbury of the 24 in Western Australia. The remainder, I'm advised, were in Perth, and 1 case is currently unlinked. So 1 case is not linked to family or that we can trace at this point in time. As a consequence of the Bunbury cluster, the Bunbury outbreak, we are extending the Bunbury testing clinic till 6 p.m. tonight. So it was originally scheduled to close at 4. It will extend to 6 p.m. tonight. So my advice once again to everyone out there across the community is, please, if you're unwell, go and get tested. If you've been to an exposure site, please go and get tested. If you're close or casual contact, obviously you have to get tested. It's very important we use our PCR clinics as much as possible to get people tested as soon as possible. And as you know, the opportunities are there for people to get tested with the most accurate testing regime we have available to us. So please go out there and use those opportunities. In terms of vaccinations, the information is very exciting. Over 12s, we set ourselves the over 12 target, unlike most of the other states who are over 16. Over 12, we are 96.9% first dose, 89.9% second dose, and we're very confident that we've already reached 90% already. So considering the vaccinations that have already taken place. So we're confident we're at 90% double dose over 12s across Western Australia, which is a terrific achievement. I'd like to thank all the West Australians who have gone and got themselves vaccinated. It's a terrific thing to do. It helps keep yourself and your family and your community safe. The third dose over 16s, which is how it's measured, is currently at 31%. So the third dose continues to grow rapidly. Yesterday at our state clinics, we had 11,285 vaccinations delivered. We don't have the full figures for the entire vaccination program, including privates, considering today's a public holiday, but 11,285 at state clinics across the state. As of Monday, the 31st of January, I neglected to tell you this yesterday, the time between second and third doses drops to 3 months. So you can get your third dose at the 3-month mark as of Monday. So that increases the availability of third doses to people and on a shorter time frame. So that all occurs as of Monday of next week on the 31st of January. Just in closing, obviously it's very sad news out of the east today. New South Wales has had 29 deaths yesterday. Victoria has had 35 deaths. Queensland has had 9 deaths from COVID. I don't have reports on the other states and territories at this point, but obviously that's very large numbers of people dying as a consequence of COVID. So our sympathies go to all the states who are going through this period and all the families who are losing loved ones as we speak.
Are all the Bunbury cases related to the Kemerton?
I'm advised they are, that they are related to Kemerton, or to Albemarle, that is, in one way or another. So the information I have about Albemarle, just so I'll just provide you everything I know. Obviously the Albemarle plant is a lithium plant, large construction project. It's been under construction now for a few years and important investment for the state in terms of downstream processing of lithium. It's a very large site. It's a 90-hectare site. It's divided into a number of areas, a number of work areas. One contractor in particular has been affected by this outbreak. There are around 30 contractors on site, but one contractor and one work area in particular have been affected. The area affected has been shut down or closed down. All the close contacts in the same work unit have been requested to get tested and isolate. There are 9 of the 9 overnight were related to Albemarle in one way or another. Everyone who works on site is vaccinated in accordance with the rules, so that's good news. The positive cases and all of the close contacts are currently quarantining. There's been 99 close or casual contacts. At this point in time, 73 have returned negative results. As I said, some parts of the plant, because it is a very large site, 90 hectares is a very, very large area, those in the same site have, and the same area, if you like, that area has closed down of construction, but there's a lot of separate working spaces across the site. The first case apparently was identified on Monday.
So, I mean, I would imagine that chemical plant's not listed on the exposure sites because it's not considered a public exposure site. Is that correct?
I don't have advice on that. I don't know exactly, but they list exposure sites on the basis of whether they can capture. I think it's the rule is on the basis of whether they can capture everyone who goes there. So sometimes there might be a location that isn't listed on the basis that everyone who went there has been captured and is quarantining and being tested.
Those people who have been out and about in the community, one assumes, now a total of 16 in the Bunbury area, there's been no exposure sites listed down. There's been no exposure sites listed for a couple of days. Do you know why that is?
No, I don't. I don't know the answer to that. I know that we list them as quickly as we can, but as I said to you before, sometimes there might be a site where they can capture everyone who went there and test and quarantine them, so they don't list it as an exposure site. This may be a case of that. I'll see if I can get further information for you.
Could it be that contact tracers are struggling to keep on top of the daily infections at this point?
No, the advice I have is that's not correct. The latest advice I had the other day was that we had over 170 contact tracers working. Now, our daily caseload is much lower than what 170 would normally manage. So, and we have a surge capacity of contact tracers up to 800. The advice I have is our contact tracing teams are working incredibly well, and as I've said to you many times, we're basically the only place that still has, in Australia, that still has an effective and operational contact tracing regime in operation.
When would you give up on the contact tracing regime? Is there a threshold for that?
Don't have an exact threshold. I recall some advice I received perhaps last year, maybe the year before, that if the rate of infections exceeds 1 per contract tracer per day, it loses effectiveness. So we have a surge capacity of up to 800 at this point in time.
And have you heard of a case in London?
No.
The union's angry there's been no or almost no communication with workers at that lithium site. Surely there needs to be better communication between operators.
Yeah, the Department of Health is working with the company to make sure that we quarantine, isolate and test everyone who's impacted. Obviously there needs to be effective communication with the affected people on site. I'd encourage everyone to do so.
We're told that they didn't have a COVID plan and the union is pushing for that to be mandated, that all organisations do. Is that something that you push for as well?
That's right. So on Friday we will be working through details of a whole range of things and COVID safety plans for a range of organisations will be part of that.
The 800 limit for contact tracing becomes difficult after we reach 800. Does that suggest that's the threshold at which we reach a high caseload?
No.
No?
This question is about Cricketer Cam Green, who just flew in. Do you know what exemption he was given?
No, I'm sorry.
Do you have the testing figures for yesterday, the total number of tests?
No, I don't. I had them for yesterday. It was around 10,000. I'll try and get you those details, sorry. But because it's Australia Day, I think some of the figures are coming in a bit late, but I'll try and get you information as soon as I can.
Given the number of new cases today, are you still confident
Look, we queried this at length earlier this week with the Chief Health Officer. He was confident that Skyworks could go ahead today. And as you know, there's a whole range of other events going ahead. I was just in a room wearing a mask with hundreds of people who are becoming Australian citizens. That's occurring all over Western Australia, these events. And often they're indoors. And we're doing them with mask wearing, and everyone, you know, I've noticed people now aren't shaking hands anymore. People are elbow bumping, which I think is probably wise in the current environment to limit the spread of virus if it's out there. So, look, in terms of Skyworks, the advice we had was we could proceed safely on the basis people wore masks and people used common sense. I expect the turnout will be down, considering what's going on. I expect most people will do the right thing. Overwhelmingly, they will. Mask wearing is compulsory. It's one of those things that you have to make these judgment calls, and the advice was that it is safe to do so.
Are you close to expanding the mask mandate to be statewide?
In due course, obviously, in due course, these things will happen.
When will be expanded due to a new G2G travel exemption criteria being decided?
Do you have that information? The Minister for Police is here. I'll just get him to answer those questions.
So, Chief Health Officers... Sorry? Oh, sorry. Good point. Out of practice. Chief Health Officer is delivering the directions that enable the G2G pass system to be updated. So, at the moment, I can tell you there are 22,000 applications on the G2G system. They won't be lost. Those ones are valid and will be dealt with, and every one of those 22,000 will receive email and text explaining that from the 1st of February the system will be live and the new system will be in place. If anyone, I would just say, message to anyone who's not one of those 22,000 and they see the changes in the criteria, don't apply now, wait till the 1st, because because the system has to be changed to adapt to the new directions, they won't be dealt with. So they'll just be frustrated. Best wait till the 1st if you're not already in the system. If you are already in the system, you will have received a text or email or both explaining that from the 1st you'll be dealt with. And there is an enhanced opportunity for direct lineal relations to reconnect. So that's something that people are probably becoming aware of. It means direct family members. They're not looking for your distant third cousin or something like that. It's just so legitimate reconnection can happen.
Just is that on that? Sorry, you can go into state to. Does there have to be a reason, like a wedding?
These are people coming here you can come here. You will still be compelled to comply with all the other obligations. You'll have to have been triple vaxxed if you're eligible, double vaxxed if you're not. You have to have proof of vaccination. You'll have to have proof of a RATS test negative within 24 hours, and you'll have to have a suitable residence to isolate in for 14 days. But it does allow people to reconnect with family as long as you're a direct lineal relative.
Can you leave Western Australia for a particular purpose and then come back a couple days later?
Look, if you're going to be meeting the obligations for entering the state, leaving, well, we haven't stopped anybody, departing, but you'll have to meet the obligations for returning. What I can say, I think providing a little bit more clarity for people returning from overseas, if you understanding that there's a cap in Western Australia and limited flights is probably the biggest limitation there. If you fly into another state, once you land, you'll be treated in the same way as a domestic traveller. So the people that, as long as you comply with all of those other obligations, you'll be able to return home, isolate at home for 14 days.
If you're an international student and intends to study here, comes in through New South Wales, and they apply for a G2G pass and be considered?
Students are a different matter. I'm talking about the categories that we have already announced. With regard to students, it's a different matter, and they'll be the criteria for them will be dealt with later.
Do you know when?
No, I'm talking about right now. G2G applications for returning West Australians, or other people who've coming for compassionate reasons, like there's someone terminally ill, or you need treatment, or things of that nature. All of the things that were listed, they remain the criteria, with the exception of this direct lineal relationship is now another possibility for people to come to Western Australia, but they must comply with all of the other obligations.
And with parents with children, what's the vaccination requirements for the children? Do they have to be fully vaxxed?
You might.
Do you know what age that kicks in?
Well, if it's the eligibility, I mean, children, it's not. I think it's only over 16s at the moment for people who must be, because that's more broadly the requirement of children out there.
It sounds like a West Australian can fly to Sydney, overseas.
Yes, that's
And then get on the next plane to WA and not have to do hotel quarantine.
correct. That's what I'm saying.
What's
So
the
the.
point of not letting West Australians just fly directly?
Well, it's about capacity in our system here for that. We've still got to be able to receive people who are flying directly, some people aren't vaccinated, regardless of whether or not they're where they're ending up. People who are coming to Western Australia under the current system, we have to comply with, the number of hotels that we've got available in the system that we can accommodate.
But if they leave overseas in the last 14 days, they fly to Sydney and they fly straight to Perth and don't have to go into hotel quarantine. How's that any different to somebody just flying straight into Perth and then quarantining?
Well, it's not, except there's a cap. So they won't, there's only very limited, there's fewer flights, so there's not going to be massive increase in flight numbers into Perth, so there won't be a capacity for more people to come anyway. What I'm saying is recognising that if there are far more flights coming into other states, there's opportunity for people to get themselves back who may not have been able to in the past. Because we've changed the rules, we're allowing people to return. As long as you comply with all the obligations, you can come back. Got to be triple vaxxed, you've got to have proof of negative RAT, you've got to have a suitable place to isolate, and you isolate for 14 days.
But just to be clear, there's an opportunity to bypass hotel quarantine as long as you fly into another state first.
Yeah, so it's giving people the opportunity to get back into Australia, the ones Western Australians returning.
What about returning university students from Western Australia? Do they fall under that school study exemption you guys talked about yesterday?
I'll answer all that.
Yeah, I'm not across the school study exemption.
I'll answer all
Some on universities as well.
You good?
Yep.
Okay.
So there's I outlined the unfortunate death rate in New South Wales, Victoria and Queensland. I just was advised there's been 13 COVID-related deaths in South Australia, of which 7 were in the last 24 hours. So can I pass on my thoughts in regards to the people of South Australia? Obviously, that's very tragic for many people there. In terms of the number of tests yesterday, it was 8,368. So the day before it was 9,500 or so. Yesterday it was 8,368. So what we want to see is our testing test numbers going up. We have plenty of capacity in our PCR clinics. So if you've been to an exposure site, if you're unwell, please go and get tested.
These testing numbers have popped up in the last 2 days, like you said. Have you had much advice around whether that's come a little late in terms of the amount of seeding that might have occurred prior to that, just considering the sheer amount of exposure sites, the sheer amount of people out there who have had Omicron in the community?
No, I haven't. But the thing about the testing regime, the more people you get tested, the more accurate the results. And so we just need as many people to get tested as possible. As I said, over in the eastern states, PCR testing is not that commonplace, whereas here it is the major way that we can ascertain whether or not you are positive, and it's a more accurate system than rapid antigen tests. So, and it's free and it's available. So please go and use the PCR system if you're unwell or you've been to an exposure site.
Are you disappointed with the testing was only 8,368 yesterday?
No, I'm not disappointed. I just encourage people to go and get tested if you are unwell or you've been to an exposure site. We've had as a state, we've had a very good run for the last 2 years. But obviously, we now have an outbreak and we're not going to be able to get it back under control. It's the Omicron outbreak. It's highly transmissible. It has some spread. We've managed to keep the spread down very significantly compared to other places, but it's out there. So please go and get tested. And if you're tested, we can find out whether or not you're positive, and then you can quarantine, you can protect yourself, protect your family, protect your workmates. It's very important people go and take this opportunity. I think because we have been Western Australia has been so fortunate over the course of the last 2 years, perhaps people aren't as likely to get tested as they are in other states, but that's obviously changing. So I just urge everyone, please take advantage of this opportunity.
As we saw gridlock, I mean, when we got outbreaks before, a couple, there were suburban streets were just gridlocked with people lining up to get tested. We just don't have that anymore, and yet we've got more cases now than ever before. Yeah,
I just urge everyone, take notice. Please take notice. Lots of people are dying in the eastern states. The best way to protect yourself and your family is to go and get tested if you're unwell or you've been to an exposure site.
What's the point of requiring overseas arrivals directly to WA to go into hotel quarantine if there's another workaround we can come through
Yeah.
the States and quarantine?
It's a good question. So we have to keep the hotel quarantine system operational. Now, it's a system that other premiers have advised me is necessary in the future. So some of them closed it down. So in the future, a lot of people will be, they will be positive. They'll have nowhere to quarantine. They will have their family, they won't be able to stay with their families. They'll have nowhere to go. And when they close down the hotel quarantine system in other states, those people were in many ways had nowhere, because a lot of hotels won't take positive people. So by having the hotel quarantine system, we can actually keep a venue for people to go if they have nowhere else to go when they have to quarantine. Now, keeping it operational is important, at least until the new quarantine facility at Bullsbrook is up and running. So whilst there are, admittedly some inconsistencies here, the greater good is served by ensuring we have an operational hotel quarantine system in place until such time as the quarantine centre in Bullsbrook is operational. We don't know when that is. We're originally, as you recall, promised March of this year. That then moved to May. Now advised it's July or August. It keeps going sideways. Now, I understand it's hard to build things at the moment. The market is hot. Everything is very difficult to build things, so I understand that's the case. We do need clarity on that because we actually have to staff it. So we continue to request clarity from the Commonwealth as to when it will be ready to open so we can staff it and use it. So its original capacity will be 500 beds. Once that is operational, that will give us somewhere for those people who have to quarantine and can't quarantine at home, somewhere for them to go.
How have you briefed at all universities on international students?
The Minister for International Education is or has met with them, and ministers are having roundtables with various industries over this week and making sure they listen. So a range of phone calls, a range of roundtables with various industries. So that's an industry that will be, and a set of organisations that will be engaged in those conversations.
What about returning Western Australian university students? Can they come home under that school study exemption?
Well, yeah, after February 5, before February 5, if they want to quarantine, yes. After February 5, obviously.
It sounds like there's a slow dismantling of this whole border happening sort of right before our eyes. Is that a fair assessment, given that we're now letting people from overseas come directly in quarantine at home?
I don't know what you're talking about.
Well, we've gone from having a very hot border was practically impossible to get in to now letting anybody from overseas come to West Australia to come back as long as they fly to another
Well, if they fly into another state, yes. If they fly into Western Australia, we have the hotel quarantine system. Various people choose various methods, and for whatever reason, and it's individual circumstances, people choose these ways. But what we've tried to do is have a mechanism by which people can return to Western Australia for compassionate reasons and get back home, subject to quarantining and subject to testing, so that we reduce the spread of the virus and we reduce risk for Western Australia, but at the same time not having a flood of people coming in and seeding hundreds or thousands of cases in the first day and week. And this is designed to try to save West Australian lives. As you're seeing over east, huge numbers of people are dying. Huge numbers of people are dying. And what we're trying to do is reduce the impact on our state whilst we get our third dose vaccination rates up. To me, it's pretty straightforward what we're trying to do here. We're just trying to save West Australian lives and stop people losing their parents, in particular older people. They're dying in large numbers over east and getting very, very ill. The death rate is one thing, but the people on ventilators, in intensive care, in hospitals, unable to breathe. This is a human tragedy. And what our measures are designed to do, in light of the Omicron strain, is to reduce the impact of Western Australia while we get that third dose up. I advised you last week, the third dose is very important to ensuring that the impact of the Omicron strain is reduced. And by doing what we're doing, we're actually going to save scores, if not hundreds, of West Australian lives. And I know this has caused a lot of consternation, but saving lives, I think, is actually the most important thing we can do here.
We're anticipating that growth of Omicron spread is kind of going to force your hand in terms of having to open up borders, bring in restrictions before you would, say, pick an actual date. I mean, we've seen in the Chief Health Officer's advice the other week that we wanted there to be a sort of threshold point chosen for just opening up in terms of case spread rather than choosing when we actually open it up to it without having much spread. So do you think it's more likely that we'll have that spread that kind of forces the issue?
Well, in due course, as I said, I think I've said it a number of times, what happened at various points in time, and I recall New South Wales had that outbreak that Victoria crushed, we crushed it, but Victoria crushed and then it came back again. Eventually the spread in Victoria was such that it was no different to New South Wales, so they didn't worry about having any border restrictions between the two states. Eventually you get to that point. But in the meantime, our vaccination rate is growing. And as you heard, 31% third dose. If we can get that third dose rate up, we'll save scores, if not hundreds of lives.
Have you had much advice around when we might start seeing sort of those case numbers rise? Sort of gone up to 20, down to 15, back up to 20 again. Have you had any kind of advice anticipating them doubling that, or you sort of get up each day and sort of in anticipation, hoping today's not the day, it goes 40, 60?
Well, it's unpredictable. That's the thing about it. So, forgive me if it's 5 or 6, I can't remember exactly, but on 5 or 6 occasions, we've actually eliminated COVID in Western Australia. Now, this time, we won't be able to do that because it's the Omicron strain, it's far more transmissible, nowhere's been able to do that. But by suppressing it while we get the third dose rate up, we can save scores, if not hundreds, of West Australian lives. I think they've hit 1,000 deaths over east now since the start of the year, and that doesn't include all of the people who have had shocking experiences. Now, as I said, I know it's tough for many people. A lot of people don't want to have to come home and quarantine, but what we're trying to do is save West Australian lives in large numbers, especially older West Australians. And I think what's lost in some of this is older West Australians, their lives count. Their lives matter. Just because you might be in your 70s or 80s or 60s or 90s, your life still matters. And we're trying to make sure their lives are preserved just like we would for anyone else in our community.
Suppression is the goal. Why don't we have more restrictions in place already, like capacity limits or density limits?
Well, it's based on health advice. So you've got to remember, hold on, let me take you through what we've got. We've got mask wearing in indoor public venues. We've got mask wearing outside today for Australia Day events. As of next week, the vaccination requirements to go into bottle shops, pubs, restaurants, cafes, numerous venues are kicking in. So unvaccinated people won't be able to go into those venues. That's an important public health social measure. And then we'll have a range of additional measures to put in place in the future as spread grows. But one of the things you don't want to do is bring in place measures too early so that people get sick of them before you really need them to take effect. And that's what all of the health advice is based upon.
Proof of vaccination also comes into hospitals. What happens to unvaccinated parents of a sick child? They need to apply for an exemption to visit their own child in hospital?
Look, I haven't considered that, but the best way of dealing with that situation is to get vaccinated.
Yeah, the teachers were pretty cross about this. unvaccinated parents can still, I know it's only for one day a week, but they can still attend uniform shops, read to the kids, all that sort of stuff. So it doesn't really add up.
Like everything, you've got to strike a balance. But I'll just make the point. People who are more transmissible going into hospitals is a serious danger to other patients. So that's why we have pretty strong rules around hospitals and aged care centres. With schools, in terms of people going in, there's huge restrictions actually on the unvaccinated in going in. There's just a small range of exemptions.
It only takes one unvaccinated parent brings it into a school, the school closes. It
is an issue, but you know, parents have got to be able to pick up their kids. But I'll just make the point about hospitals and aged care. The people in hospitals, the people in aged care are far more vulnerable, which is why the vaccination requirements are in place.
Just on the new exemptions, will there be a pathway for overseas workers to accept jobs in Western Australia through the new exemptions that come in from Feb 5? Or is that not under consideration?
There are some rules about specialist workers. So if we need someone to fix a cancer machine in a hospital, or make sure the Karratha gas plant can continue to operate, those sorts of things, we're going to have to make sure that there are some exemptions for people in those circumstances, as we have, by the way, throughout the entire pandemic.
But not more generally for, like a bricklayer or any other occupations?
No. Look, I know there's labour shortages, but I just make the point to you. The NAB Business Confidence Survey came out today. Business confidence is down 24%, and that's largely New South Wales. The ANZ credit card data came out the other day. The rate of credit card spend in the week to 10 January in New South Wales was down 24%. In Western Australia, all of these things have remained stable or climbed. Other states' economies have had massive impacts because of what is going on at the moment. I've read some stories on ABC about the foot traffic in Parramatta and the Sydney CBD, down by 50%. People actually just going out. I read some stories in The Age and the Sydney Morning Herald about all of the people, the restaurants in Melbourne, who basically can barely open because basically staff aren't coming, people are sick, people are afraid to go out. That's what's going on. Now, I know there's labour shortages here, but just think about that. That's a pretty big problem, pretty big economic problem they're having over East that we are trying to ameliorate with the measures we're putting in place, having watched and hopefully learned. Now, when it gets here in large numbers, there's going to be debilitating problems. There's going to be lots of issues. That is unavoidable. If anyone is of the view that somehow, when you have large community spread of COVID in Western Australia, it's all going to be sweetness and light and there'll be no issues, that is wrong. There will be lots of issues and lots of problems and lots of people will get sick. But everything we're trying to do is to reduce the impact, to ameliorate the impact, to save lives, whilst we get that third dose vaccination rate up, because all of the advice is the third dose vaccination will save lives.
So my question goes back to cricketer Ken Green. He arrived in Perth this morning. How could he get that exemption and how do you feel that?
I don't know who he is, I'm sorry.
Okay, he's a cricketer from Western Australia.
I'm sorry, I'm unfamiliar with him.
Is there a...
I'm unfamiliar. I regret to inform my cricket knowledge. I've had a lot of things on my mind. My cricket knowledge is not that strong at the moment.
Is there a difference?
Have you heard of Justin Langer?
I have.
He's also apparently having difficulties getting back to Western Australia.
Well, he is clearly a West Australian, so after February 5, the pathway to get back is there, provided people are prepared to quarantine. In terms of this gentleman, I don't know the circumstances. I'll see what I can find out for you.
With that 7 deaths in the past 24 hours in South Australia, we talked about watching and waiting, the kind of restrictions we put in. Are we going to have to go tougher than them? Because the kind of amount of deaths we've seen in South Australia, as a comparison over just the start of the year or since COVID started taking off, there I think it's well over sort of 50 now, which is about half of what was projected under our Delta 90% kind of modelling. So we're talking about stopping as many people sort of dying as possible. We kind of have to go tougher than South Australia with the restrictions we put in place.
Look, the public health social measures. So, look, the information I just saw, it just said that there's been 13 new deaths, of which 7 were in the last 24 hours. So I don't exactly know what that means, but that's what it said. So That's a lot of people. Look, in terms of the measures we put in place, the public health social measures, I think the key point here is when you bring them in. Now, South Australia has actually been stronger on these than some of the other states, particularly New South Wales. That's reduced the spread and probably saved lives. But we'll monitor very carefully when we bring them in so we get the balance right about bringing them in at the right time, because once they're in, they're going to be in for a long time. So, you know, you have to bring them in at the point in time you need them, because you don't want people to get too sick of them. Because if they're in place for months, the limits on people going to venues, the limits on activity, all that stuff that we did last year or the year before, you do it too long, you start to get people sick of it and not complying. So we'll bring it in when it's appropriate, but we already have pretty strong measures, and like all of you, all here wearing masks. Mask wearing isn't the greatest of things, but it's going to be with us for months and months to come. So we'll bring further ones in due course, but we'll be very, very carefully advised by our medical professionals on the right time.
Will you go earlier than South Australia? Like I think December 27th is when they really kicked in with the hard restrictions on having hundreds of
probably.
cases.
I would expect we would go earlier than South Australia. They waited till they had very serious community spread. We'd probably go earlier than that. New South Wales, of course, put them on, took them off, put them on, took them off. The thing about them is, once they're in, they're probably going to be in place for a long period of time.
One long COVID one. Has your view on Australia Day and changing the day changed at all in the last year?
No, I've answered all those questions before. Obviously, it's a controversial issue with lots of people. I understand all of the arguments. It's really not my focus at this point in time. Thanks very much.